Hello, and welcome from our team at the University of Minnesota in the Mycosis Study Group. I'm Dr. Matthew Pullen, the lead investigator and clinician on this project, based here at the University of Minnesota. We are eager to introduce you to our study and to have you on board as we answer some of the burning questions doctors and patients have about treating fungal infections. In this video, we'll give you an overview of what participating in this study means for you and how we are handling and protecting your data and other details. In this study, we're looking for people who have been diagnosed with specific fungal infections, including histoplasmosis, blastomycosis, and coccidioidomycosis. These infections are becoming more common across the United States. While we do have medications to treat them with, there are still unanswered questions about the effectiveness of those medications, the cost of treatment, and the types of side effects people have while taking these drugs. That's where you come in. If you agree to participate in our study, we'll ask you to fill out an enrollment survey that asks you about how you were diagnosed with this infection, what symptoms you've had, any treatments you've received or are currently taking for the infection, and how your symptoms have improved or worsened while being treated. We will also ask you some basic information about where you live, recent travel destinations, and other medical conditions that you may have that contribute to developing a fungal infection, like diabetes, immunocompromising conditions, COPD, tuberculosis, or HIV. This information will help us understand the different risks that can increase a person's chance for developing one of these fungal infections. This initial survey should take about 15 to 20 minutes to complete. After completing the first survey, you'll be automatically emailed invitations once per month for short follow-up surveys, each taking about 5 to 10 minutes. These are focused on seeing how your symptoms change while you continue your treatment, as well as finding out if you've had to change your medications due to side effects, cost, or ineffectiveness. None of our surveys will ask you any questions about sickle cell diagnosis or treatment, genetic history, mental health, or drug and alcohol use treatment. You'll receive these follow-up email surveys for 1 year. Now let's talk about your data and how we will use it.
Unlike a clinical trial, this study doesn't provide medications or change your treatment plan. Instead, we're asking you to provide us with the data about your health and treatment so we can better understand the challenges that people face after being diagnosed with a fungal infection. Anytime someone is sharing their personal data, privacy is a concern. We take protecting your data very seriously. Our surveys are stored in secure servers housed and managed by the University of Minnesota. We follow all university and federal guidelines for medical data security and strictly control which members of our team have access to the database. The only time your data may be shared during our study would be in collaboration with our network of researchers at partner universities and with regulatory officials from the University of Minnesota or CDC. This sharing is to make the most efficient and effective use of your data and to ensure data integrity and security.
When we use your data to answer questions within our study, we will first remove any identifying information that could connect you to your data. This is a standard method for protecting participant privacy. Similarly, anytime results from this study are used in future publications or for future studies with other colleagues or collaborators, identifying information will be removed from any data used. You may not receive notification or a separate consent form about future studies that use these data. While the study is ongoing, our team will host annual open house style meetings for participants and other stakeholders. This will be a great chance for you to ask questions about the study itself and the progress we're making, as well as raising concerns. Once our study is complete in late 2029, all participants will receive an email containing a summary of study findings, as well as copies of any publications resulting from the study.
Our study does not involve asking you to take a different medication or alter your treatment in any way, so we cannot promise any medical benefits by participating. This study also does not offer financial compensation. The main benefit of this project would be your contribution to our understanding of fungal infections, which could help future patients receive more effective treatment. The primary risk associated with participating in this study is related to data privacy. Though we take protecting your data very seriously, and the risk of data exposure is low, any program that collects and stores data is at risk of a breach. Should this occur, we will let all participants know and will provide information about what data may have been exposed. If at any time you wish to withdraw from participating in this study, all you have to do is email us at fungalstudy@umn.edu with your request along with your name and date of birth. Withdrawing from the study has no impact on your medical treatment in any way. We will make sure you stop receiving emails from the study. Though information you have already shared with the study may still be used for our analyses.
Thank you again for considering participating in our study. We truly could not do this without you, and we hope that you'll join us in exploring these unanswered questions about fungal infections. After finishing this video and moving on to the enrollment survey, you'll receive a written copy of this consent information in your email, along with contact information for the study team. Our email is always open if you have questions, concerns, or thoughts about the study.